Good afternoon. I'm George Latimer, Westchester County Executive, and today is our Westchester coronavirus update of the 2 o'clock hour. This is Monday, June 29th, and we're here in Chappaqua at the offices of the town of Newcastle, which is the town for which Chappaqua is one of the hamlets. We're here today because of the recent outbreak that occurred late last week, and we wanted to talk about that outbreak a little bit. I have with me here the Commissioner of Health, Public Health for Westchester County, Dr. Sherlita Amler. And I'm also joined by some other individuals that I'm going to introduce, including our county legislator that represents the area, the deputy supervisor as well. First, as I usually do, let me give you the general Westchester numbers right at the top for where we are as of today, Monday, June 29th. This is directly from the New York State Tracker, the Department of Health Tracker, which you can find online. The number of positive cases year to date, which now summarizes almost 4 full months, is 34,798 individuals. That number is 18 more positive cases than yesterday. Keep in mind that whatever we're going to talk about vis-a-vis Chappaqua or anything else in the county, the total increase in positives from yesterday to today is only 18 additional cases. And I think that's important because we want to put stories into perspective and not, let necessarily the emotion of the moment run away with us. The number of active cases we devised by subtracting the number of positive cases from 2 weeks ago, because it's a 2-week incubation period. If you tested positive, 2 weeks pass, and you haven't gotten sick, then therefore you have worked the virus through your system, you've defeated it, and you're no longer an active case of COVID. You might be contagious, but you yourself are not in any health jeopardy. And if I say anything wrong, she's going to kick me. The number of active cases right now is 471 in Westchester County. That's down 19 from the total that we had yesterday of 490. When we were last reporting on active cases, we were in the range of 500 active cases. To put this into perspective, 3 weeks ago today, on Monday, June 8th, we had 951 active cases. So when you look at the tracker, you may see, and you will see, in fact, blips up and down in terms of total in terms of total number of people that may be affected by COVID, but the general trend line has been dramatically down in 3 weeks to go from 951 active cases to 471, which is the number that we have today. Number of hospitalizations today, we have 73 individuals hospitalized for COVID. That compares 3 weeks ago to 160 people that were hospitalized. So again, a rather significant reduction in the number of hospitalizations. We lost 4 people overnight, fatality to COVID, 1,424 total deaths. That number 4 is a bit unfortunate for us because we had 2 consecutive nights of 0 and then a night of 1 fatality, and now we've had a slight jump to 4 fatalities, dramatically down from where we were at the height of the contagion when we lost 35 and 45 and so many odd people. And the number of people that have been tested is significant and growing every day. We have to date 263,260 tests for COVID. Now, I mentioned we had not quite 35,000 positives. That's a ratio of about 83% of the people that get tested test negative. 17% test positive, the 34,000 being the positive number out of the total base of 263. That's important to note. 3 weeks ago, since we're using that as a comparable, June 8th, which by the way was 2 months to the day when we started tracking these numbers. 3 weeks ago, we had 186,561 tests compared to 263 today. So the math tells you 77,000 tests in the space of 3 weeks is roughly slightly over 25,000 tests per week of COVID, and based on a population of 1 million people, 263,000 is 26.3% of the population that has been tested. And again, the vast majority of them have been negative for COVID. But those that are positive are the ones that we look at because they are the ones that could, in theory, become sick, become seriously ill. Some small percentage of them may suffer fatality. Guess I should announce Metro North has added additional trains on the various lines, one of which we hear right now. The the overall set of numbers are continuing to be encouraging. However, the story that we're here to review in Chappaqua is a cautionary tale for all of us. Public health officials have told us that it's essential for us to do certain basic things to stop the spread of the virus. Those are the things that are within our control. We mention every time we talk, there is no vaccine, there is no antiviral treatment if you contract the disease. So we don't have those tools to work with. We have very limited tools. One of the tools we have is wearing a mask so that I don't project anything to you when I wear the mask. If you wear the mask, you don't project anything to me. It's not a political statement. This is not an ideological statement. This is simply to prevent the potential spread of the disease. I've seen a lot of things online. A lot of people have had a lot to say about the topic. To me, I read it. I understand you don't want to wear a mask. I don't want to wear a mask. I didn't wear a mask before this pandemic came up, even when I had severe colds in the past in my life. But we are trying to prevent the spread. That is why we wear masks. That's the only reason why we wear masks. Social distancing is also a concept that's foreign to us in our culture. We naturally greet people warmly. We certainly shake hands and we hug people, particularly if we haven't seen them in a long time. And if you're at a high school graduation, these are fellow students that you grew up with from childhood, and this may be the last time you see them as you all go off to college in separate lives. So it's logical to think you would hug and kiss and have an emotional connection moment. But we can't indulge ourselves in that right now because that also can spread the disease. And washing our hands, using hand sanitizer, sanitizing surfaces to make sure that there's nothing on the surface that you can pick up as part of this. This is an important part of the tools in our drawer as well. It's probably the single biggest reason why certain things in the county aren't open. Some things are open, some things are not. We would love to be able to open the kiddie. There's one right over there, kiddie playground. Kids want to play. I did when I was that age. My daughter did when she was that age. You want to climb and what have you, and you'll touch surfaces, and you won't think of social distancing, and it's an easy way to spread the disease. So the ability to sanitize surfaces as well as sanitizing your own hands is an essential part of all of this. In the Chappaqua incident, as we have seen it, and I'm going to ask Dr. Amler to talk more thoroughly about it, we have an exposure that we track back to the events of the high school graduation for Horace Greeley High School, which involved both the graduation itself and parties that happened afterwards. And any of us who've been through high school, I assume everybody that I'm looking at has graduated high school at some point in time in their life, we can absolutely relate to the emotion of the moment. As I just said a second ago, you're seeing friends that you've had for all of your life. As you part company and go in different directions, this may be the last time you see them for at least a long time, and it's an emotional moment. It's a natural social connecting moment, and as happened at this particular situation, there were individuals that were not properly masked. They did not properly socially distance. We have reports now there were at least two sets of individuals, families if you will, that were in Florida prior to the graduation and the party after the graduation, and at least one individual and a representative, an individual from the other family, both contracted COVID. We believe they contracted it in Florida, where they are now going through what we went through in March and April, which is a quick spread of the disease everywhere. We went through a period of time before everybody understood exactly what we have to do to fight it. They're going through it knowing that the challenge at hand is masking and social distancing and sanitization and so forth. One of the individuals who was identified did not exhibit symptoms at the time of the graduation, but did thereafter, was tested, determined to be positive, and our testing process now by the County Department of Health has identified, and I'll let Sherlita go into the details, in the vicinity of a dozen individuals that have tested positive. Now, that does not mean that they've been hospitalized for the illness. That does not mean that they are in any way on the verge of a fatality, but they have the disease and they are potentially able to transmit the disease to other people, which is why we use the tool of isolation to keep people away from other people and therefore spreading the disease very quickly. We saw how this started in Westchester County with the index patient in New Rochelle. One individual took sick after having been at a number of events over the course of a weekend, inadvertently infected other people, no fault of his own, and we wound up with a cluster of 100 that then morphed into 1,000 and morphed into the situation that you have now. I'm going to stop for now. I'm going to ask Dr. Amler to provide a few more of the details as she has it. Keep in mind that there are HIPAA laws that limit us from being able to talk about certain kinds of things, confidentiality. Also keep in mind that it's the state that ultimately has the testing results and the information, and they release what they release to the county. We want it to be forthright in this update, give as much information as we can, and then I'll talk a little bit about the role of the school district and the town in this issue. Dr. Amler.
So I thought you might be interested in how this kind of situation works out. So the health department, every morning we get a list of individuals who have tested positive in the previous day. And a staff member then calls all the individuals who are positive to take a case history. So they're asking them, did they have symptoms? Where did they travel to? Who did they spend time with? Who might they have exposed? To try to understand both where they might have gotten their infection from and who they might have given it to. All of the positives that we get and we interview, that information we kind of look at as try to look at it as a bigger picture. So are there people who are being named by more than one individual as a positive possible contact? Are there events or locations where multiple people are testing positive? And we call these clusters. So the idea is to, if you have an area where you're having a number of hot areas, so to speak, a number of positive individuals, that we can actually focus very detailed on what's going on there and try to prevent further spread. So that's basically what happened here. So we have at the present time around 14 individuals who have tested positive that we believe are somehow or other related to each other. They've had maybe not to all of each other, but as a group were either in the same event or around the same people. And we elicit contacts from those individuals, and those contacts are then provided to our contact tracers, which some of them are not even located in the county. They're individuals who are sitting on a computer with a phone. We provide the information. They reach out to the person who's been listed as a contact to a positive case, and they ask them, do you have symptoms? Where have you been? And if it's appropriate, they'll guide them as to how they can get testing done. And if they need to see a doctor, they can advise them on that. And they will place them into quarantine. Quarantine is 14 days from the exposure of the individual to the positive case. So during that time frame, people are asked to please not be around other individuals. So that means if you're sharing a house with someone, we hope that you have a bedroom and a bathroom where you could isolate yourself away from others, so that if you become infectious, you won't spread the disease to others. Now, some individuals don't really understand what quarantine means, and they may decide, well, if I go get tested and I'm negative, then that gets me out of quarantine, right? The answer to that is no. If you go get tested and during your quarantine process, you could have multiple tests during your quarantine process. That will not release you from quarantine. The only thing that releases you from quarantine is 14 days remaining symptom-free from this infection. So we encourage people, if they want to get tested, and we'll help them do that. But if the tests are negative, please don't go to the grocery store. Please don't go get your hair done. Realize that you are still in quarantine. We do occasionally send health department staff to people's homes to ensure that they are in fact doing what they're supposed to be doing and remaining in quarantine. So somebody may knock on their door just to check to make sure that they are in fact there. We are asking people, if you get a phone call and it says New York State contact tracers, that you answer the call. If you don't answer, we will continue to try to call you over multiple days. If we still can't reach the person, we will send a staff person to their home to try to find them, let them know that they have been named as a contact, that they need to be tested, that they need to place themselves in quarantine, and not to expose others. So I think that that's the really important stuff that I think you need to know from my perspective around this.
Thank you, Sherlita. So I just want to recognize that we're joined today by the Deputy Supervisor for the town of Newcastle, Jeremy Saland, who is with us here. Supervisor Ivy Poole and Deputy Supervisor, the members of the town board, have been involved in tracking the situation. It does not fall within the town's authority to govern, but as town officials, they've certainly been alert to it and trying to deal with the aftermath of this. Legislator Vedat Gashi represents Newcastle on the Westchester County Board of Legislators, and we appreciate his involvement here as well today. And Lieutenant Dumser from the town of Newcastle Police is with us here on behalf of his department, and we appreciate the role the police have played. The basics of this, you may have heard it before. I'll try to go through this. Hopefully I have completely accurate information. Do correct me if I make a mistake. In fact, the graduation ceremony for Horace Greeley High School occurred on June 20th. It was a drive-in graduation, and it is from that event where 13 attendees have since tested positive. Not necessarily all graduate students, but people that were involved in some period of the graduation. Could be adults as well as students. We don't have, for public dissemination, that breakdown. We understand that at least one student and family and a separate family had recently traveled to Florida and then also attended the event, which is right here at the Chappaqua train station, just adjacent to where we are, showed some symptoms after the graduation and after the field night event and tested positive. The drive-in ceremony was preceded by, was followed by a field night event in which juniors and seniors and students from surrounding school districts also attended. Not all of the positive cases are from the town of Newcastle. We believe that some number of them, one or more, may be from the adjacent town of Mount Pleasant, because there are people who physically live in the town of Mount Pleasant whose students attend Horace Greeley, and at the field night event there were students from other neighboring high schools that might have been here as well. So this is not just an event that affects Greeley High School or Chappaqua specifically. The graduation was a school-sponsored event. The field night was not an event sponsored by either the town or the school, and this is nothing unusual. In every community where there's a graduation, there are all sorts of events that are planned individually. They're planned by family members. Combinations of young people get together to gather. And I think one of the important messages to take out of that is this particular event happened in Chappaqua. It could have happened anywhere in this county or in any other adjacent county. The dynamics of the high school graduation experience is experienced by every high school senior in every high school across the United States of America. The fact that it did happen here is not a particular mark, but it is important to understand that if it can happen anywhere, then the things that we've discussed already, the mask and the social distancing and so forth, is essential everywhere. If anybody thinks that because it happened over there, it doesn't affect me, it could happen in your home area. And it doesn't have to be a high school graduation. It could be an Independence Day event that you may host at your home. And you may figure that everybody who's going to attend are people you already know. So you're not really particularly concerned about any of them being exposed to COVID. But you don't know that they haven't been exposed to COVID. And it could multiply out over the course of any event that happens over the course of the next few months. If anyone has attended that graduation or the field light event or any graduation party since then, we do encourage you to be tested so that you will know. The mandatory quarantine that Dr. Amler spoke of is executive order from the governor. He has mandated that if you're traveling into New York, either visiting and you don't live here, or you live here and you're coming back to New York, and you've been in one of a number of states, he made a list of them, I think, on Friday night, and we can certainly provide that to the press if you don't have it. If you come from any of these different states, then you may have been exposed to COVID, and you need to quarantine for 14 days. And as Dr. Amler said, the presence of a negative test, a recent negative test, is not sufficient to stop the quarantining of the individual. The Newcastle police has sent out a notification that directs the quarantine, and it is the Newcastle Town Police and, by backup, the Westchester County Police that have to enforce these orders. Practically speaking, whether you live here and are under this quarantine or you've just come back from one of these states for other reasons, do not let us have the police come to your front door. This is for your health and the health of the people that are closest to you. And you might be fit as a fiddle, able, younger, of stamina. Some young people have gotten this, and some people in younger ages have died from this. But you must have a practical mind about this. And I can understand no one wants to be quarantined for 14 days. Nobody wants to wear a mask. I can't stress it enough. Too bad. Too bad. This is a disease that has killed 1,400 people. And the pleasurable use of my time or your time is secondary to stopping the spread of the disease, because more people would die potentially. So the quarantine is required by law. But again, neither the Newcastle Police, nor the neighboring police departments, nor the county police department want to use a heavy hand in enforcement. Some people ask us to do that, write tickets and go further than that. We believe common sense has to prevail. And what it takes to get through to those folks, there are some people who have an ideological belief. You can have any ideological belief you want, but if you're spreading a disease, you're potentially helping to kill somebody else. And that isn't qualified under any right for philosophy. And for those people that, they're of a certain age, they think they're young and they're indestructible, why test that? Or why test it and have it affect your grandmother? Or have it affect your aged uncle or aunt? Or a cousin who has an immune system that's compromised? You have a relative who may have cancer treatment, might be HIV positive. You compromise their life because you want to have a good time. We all want to have a good time. And this is part of the sacrifice and the self-denial that we've talked about since March. If we're going to overcome this disease, not just in Chappaqua, but in the United States of America, it will take self-control, self-discipline. There are not enough police in the world to come to your front door to make you do what you know is right. And I say that with an intensity, not to lecture, but to show the importance. This spike is something we've expected to see. It has happened here. This won't be the last spike. It'll happen again, because someone may not hear this or may hear it and say it doesn't affect them. But it is absolutely critical. The contact tracing program that Dr. Amler laid out is what the county government is responsible to do, and we have had help from the local government. We appreciate that support in trying to identify people. Right now, the professionals of our county health department are able to handle the numbers of positive cases. But if that number rises dramatically, we will have to tap those that have been trained and bring in people who functionally will be doing this as a secondary function into primary use for contact tracing. And it's an intrusive process. If you call me and you want to know every person I've had contact with in the last 14 days, you guys might be part of that list. And the people that you're in contact with, that's what's at stake here. And that's why it's so important to wear the mask. We want to thank the fact that Caremount Medical has made available tests. 200 tests were done on Saturday. They stayed open late. We appreciate that. That's a very helpful step in that right direction. And we have in Westchester County now many options for testing for COVID all across the county. Very different from where we were when the first outbreak came. We had very little testing available. It was only in-home testing by a small cohort of our people. Now that is much more a possibility. I'm just going to touch on a couple of other points. We'll go to questions. There are special education programs that have been allowed for by the state of New York, which start on Monday, July 6th, a week from today. The county health department is working to help teachers and administrators this week get tested, and so that we know exactly what their status is as they go to start those programs in a week. Any other schools who will have programs, as Chappaqua has here, please contact the county, and we'll be happy to work with you for any of those programs that are starting. I want to also highlight that this weekend we opened 2 of our 4 county pools. We're scheduled to open 2 additional pools next weekend. We're going through a protocol that makes it very different. There are 2 swimming sessions in the morning and the afternoon. It's not the continuous situation. You need to call ahead. You need to make sure you have available wristbands, because it's by a certain number of reservations. Someone just gets dropped off at the pool and says, okay, get a ticket. That's not the way it worked that way last year and the prior years, but it may not work this way this year. But we want to have the recreation available, but we want to have it available on a safe level. We're going to talk tomorrow about some of our other facilities, notably Playland, but we'll save that for tomorrow's update. These updates will end a week from today on Monday, July 6th, which will be the last day that we're in Phase 3, which is where we are right now. And then as we approach Phase 4, we'll provide updates more irregularly, perhaps when we have news breaking or if we hit a particular milestone. Obviously, we're hoping to continue to see the general diminution of the numbers. We've continued to see that on any given day. We might have a little higher number of positives, and generally it's also tracked by having a higher number of people tested on those days. The percentage is still around 1%, slightly above sometimes, slightly below. But I also caution people At the other side of the spectrum, there's some people who want us to open everything immediately, and there's some people who want us to close everything immediately. Do not judge trends based on one or two overnights. We have good nights in a row, and then we have some bad nights in a row. It's like trying to judge the economy of the nation by the stock market. The stock market drops 700 points on one day. Everybody has a reaction. A couple of days later, the stock market goes up, and everybody has a reaction to that. The trend line is seen over an extended period of time, and the extended trend line here is that we have a diminution of the infection. But we have to do the right thing to make sure that a spike like this doesn't wind up becoming something bigger than it is. And let me close my general comments by thanking Dr. Amler, Renee Recchia, and the people of the County Department of Health. The system worked the way it was planned to work. A spike occurred. The County Health Department, coordinating with the State Health Department, jumped in, did the contact tracing, could identify, could test, and that's exactly what we have to do. So I want to thank Dr. Amler and her team. Please convey that to your team, that this is not something to be frightful of. This is something to be appreciative that the system works, and let's hope the system doesn't get tested too many more times like that. So with that, I'm happy to take any questions that you may have. Tony?
I don't know, maybe a question for the Deputy Supervisor or for the Police Lieutenant. The statement from Superintendent Ackerman says that they issued clear guidance and protocols for the families that went to the graduation event. Quote, unfortunately, at the event and despite police presence, numerous individuals failed to follow our protocols. Did the police warn anyone, put a mask on? Did the police issue any violations for not social distancing?
I don't know if anyone is capable of answering that question. Do we know? If you'd like to, yes, feel free.
We did have two officers going through the crowd. They told the school district to make an announcement for everybody to go back into their vehicles. The school district did do that. Two officers were going through the crowd. They were putting reminders out to everybody. We did not issue any summonses. Most people were complying while the officers went through. In fact, those two officers now, we have them quarantining as well. So they were listening to us while we went through. It was just 300 some odd people, and can't get to everybody at once.
And Lieutenant, your name is?
Lieutenant Dumser.
First name?
D-U-M-S-E-R, James.
Thank you.
You're welcome.
Could I add something to that?
Please, go ahead.
So obviously, if anyone's listening who was one of those people who got out of their car or went to any of the after graduation parties, just a reminder that the governor has placed you under a precautionary quarantine, so you're supposed to be home for the next 14 days. And if you think you need testing or have any questions, feel free to call the health department.
Lieutenant and County Executive, in light of what you said and understanding that there's a high level of self-control that's needed here and individual responsibility, but I don't know if you had a chance to listen to what the governor had to say this morning, and he strongly emphasized that there needs to be greater and more diligent enforcement at the local level. So, in light of what the lieutenant just described about their presence there, and going through all that you said, it almost sounds like the governor is saying you're not doing your job at least well enough.
Well, I don't know if that's what the governor is saying, Joe. I think what we certainly have done in the county government is have county police out policing our parks. If you went to Playland Beach or the boardwalk, if you went to Croton Point Park Beach, if you went to either of the two pools or Kensico Dam, you'd see a very significant presence of county police as well as park department employees. I think what the lieutenant said, I don't know if he wants to comment on this, we still deal with the fact that there are large quantities of people in a confined area. And we'll just imagine it here. If there's a group of people over here, and I have 2 or 3 police officers assigned, and they deal with this, and one's dealing over here, it is possible that you could look and see a group of people over there that are clustering, and through normal police work, the people involved or Parks Department work would get over there. So I don't know that it is or isn't a lack of enforcement. I think what happens is when you deal with large groups of people, graduation, you would need an army of people out there to be with every possible cluster that exists. We have that challenge on Bicycle Sunday. I think in the main, we have done a very good job in local government and in the county government enforcing this, because how many months now have we gone and this is the first spike that we've covered? Doesn't make it right. It just means that we have to redouble our effort. But I don't know if, Lieutenant, if you want to comment, it's your option. All right, I'll let that stand on behalf of both of us.
I have a question about contact tracing.
Yes.
I'm just wondering how fast it will work. I mean, about a week ago, this graduation happened. Since then, multiple
Well, it doesn't happen like spread over time. It's you're dealing with one person at a time. So as soon as like I said before, as soon as their test is positive, that information is provided to us. Someone should call them that day. The time limiting feature there is, do they answer their phone? And we call them, like I said, multiple times. We call them over 2 days. If they don't answer over 2 days, someone goes to their home. This all depends on the fact that they gave the lab appropriate contact information so that we have the ability to track them down. If we can't, then we do try to elicit information from other sources as to how we can find them. Once we found them, they give us names. That same day, there should be someone calling them, giving them information and getting information from them. So it should work very fast. But the rate limiting step here is people picking up their phone, being willing to talk to us and provide us with the information, because we can only work on the best information that we're giving. So we really need the help and assistance of the public, and I really ask people to please help us, because by helping us, you help keep all of your neighbors and friends and all of us protected from this virus.
Doctor, point of clarification, I heard two numbers throughout the news conference.
Okay.
14 and 14.
Well, the numbers keep changing, and so that's why we hate to give numbers. But I just
I'll
went.
refer to her number.
When I just left my office, the last thing I did before I came here was ask what the number is, and the number is 14. It could be more than that, now, but the last number I was given, which was at 1:30, was 14.
Thank you. And doctor, can you please clarify, earlier you said that the cases are related by the event or related like as in the same family?
They're related by the event. What we have more than one person who's tested positive, so I don't want people thinking all of this is the result of a single person. We have more than one person who's tested positive, who had travel history to Florida. It's in more than one family. I can't be too specific because of HIPAA, but I can tell you that, of the 14 people that are positive, these people are interrelated either by where they were or association, personal association. But that's what constitutes a cluster. Sometimes it's just you were all at the same location. Sometimes you may be related, you might be friends, you might know friends of friends. And so that's why case investigation takes a little time and effort, because it isn't as simple as just identifying the place. You actually have to dig into it. And so now when we get a positive, even if it's not somebody we know about, one of the things we're doing right now is all the positives that we got today, we look at as, is this anybody who could be related to this cluster? I mean, by age, are they of an age where somebody might be graduating from high school? Or do they live anywhere in the proximity here? Have they any relation to any person that we know of? It's a very tedious, very time-consuming process, but it's the only way to get to the people we need.
Can you confirm that a Pleasantville High School student tested positive for COVID? I don't know if he or she is one of the 14 cases.
I do not know of a Pleasantville student that's positive at this time.
As she got the last number right at 14, rather than let me update this information, we do understand that at least one of the students lived in the town of Mount Pleasant. Pleasantville is part of that town. I don't know if the student lived within Pleasantville, but it is at least one person from the town of Mount Pleasant that tested positive. And we highlight that because if you look just at Newcastle numbers, when we break them down, that may not be the full amount of the contagion. Some of it may be found in Mount Pleasant. And through contact tracing, we're going to find out whether these young people had interactions with other students from other high schools, and you may see signs pop up in other places.
Let me clarify that, because I think what you're asking me, and because I don't know the address of all 14 people, but I think what you were asking me is, I was called this morning because there was media inquiries around, was there some young lady from Pleasantville who was positive? And in looking at that, I could not verify that. So I can't speak to the other 14, but the rumors about the young lady today, I was unable to verify.
Okay, any other questions anyone else has? You're certainly welcome to interview anybody one-on-one. You can stand out here and work on your tan, which I think I'm just about tired of doing. Let me just say before we close, are there any, do we have any, I'm sorry, okay. We have one remote.
Low HUD remotely. They asked if there are any new cases from the Bronxville protest positive case.
Are we aware, Sherlita, of any
Not that
positives
I-
in Bronxville?
Not that I know of.
At this point, we're not aware that any are confirmed, but that isn't a final word on it. We'll wait and see what develops as we go forward.
Two more. Has there been much trouble getting people to pick up the phone for the contact tracers?
Yes, that is a problem. I think a lot of people, one, now don't answer their house phones. They have cell phones and they maybe only keep their house phone for whatever reason, their security system. If your phone rings, please look at your call answering to identify where the caller is. And if it's coming from New York State contact tracers, please pick up that phone. Or if you get rapid calls, more than one call, like bang, 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 it may be us trying to get you to pick up the phone. So we really do need people to answer their phones.
One more from him. Currently, what is the total of people quarantined relating to this incident at the residence?
So the isolation number would be 14. That's the number of people who are confirmed positive. And so if you have the infection, you are placed in isolation. I don't have the exact number for the quarantine, but certainly if you were named as a contact and we can validate that information is true, you would be placed into quarantine.
And one more, George, for you from Mark Silver.
Yes.
How confident are you that action was taken quickly enough to hold down the spread related to this graduation?
I'm reasonably confident. I think the contact tracing system that is in place and the professionals that are executing it will be able to identify a fair bit of the spread of the contagion, and I believe that people, and particularly because the media has covered this outbreak very thoroughly, they understand what's at stake. So I don't think we're looking at a situation that's analogous to how this all started. When it happened, we didn't have a contact tracing system in place. We didn't have easy COVID testing in place. We didn't really know quite what to expect out of the degree of contagion. And I think our experiences now for 4 months make us better able to try to be able to contain this. Having said that, anybody that speaks declaratively about this disease is kidding themselves. I mean, this disease is very able to fool all of us and do something we don't expect. So that's why I'm reasonably confident, given the resources that are applied to it, that we'll be able to resolve it. That doesn't mean there won't be additional spike in cases. That doesn't mean that our numbers won't show more active cases rather than less active cases over a certain period of time. And I would look for the 2-week cycle to resolve all of that if everything comes through. Yes, go ahead.
So the graduation was on June 20th, but the individual, we did not get positive test results back until the 24th, and we did not get results till after that. So you have to understand that an event may happen, but you may not know that someone positive attended that event until they go in and get tested and those results come back. And then the health department is notified. And at that point, we can jump into action and move forward. But there could be several days between an event, the person being tested, the results being back, the department being notified.
So from this perspective, the clock started ticking on the 14 days on what date?
I'm not understanding your question. So the person goes into isolation on the day that they test positive, unless they're symptomatic.
The earliest individual that tested positive regarding this cluster was
Would be on the 24th, so it'd be 14 days from there. But again, if to the general public, those individuals who attended graduation, got out of their cars, or went to some of the parties afterwards, their 14 days starts then. So their quarantine will not be up until July 5th. July 5th for those individuals.
And just to try to clarify that now as we wrap up the conversation. So if I am infected today and I don't know it, I start to show symptoms a couple of days from now, I go in and get a test, that's when they know that I am infected. My 14 days might actually have a couple of days in front of it, but in those days before I got tested and got my result, I infected a bunch of other people. So their 14 days didn't begin in the real world until, I called to tell them, hey, I got it, you may have it. and then so the 14-day period may be longer for the people that you infect. It's hard to know exactly, but that's the gist of it. Let me just close by saying that this incident happened in Chappaqua, but Chappaqua as a community has not been set backwards in general. The business community is open. The functions and activities of the community continue. I think we had this happen with New Rochelle in the beginning of this. You attach to the jurisdiction something that really applies to individuals who live in the jurisdiction, and it would be to misrepresent circumstances to assume that it is the geography of Chappaqua that is somehow uniquely infected. There are people who live here who have been exposed to the disease, but Chappaqua itself is open and operating and continuing its daily life, business life. With that, thank you all for coming. We appreciate it. We'll give you an update tomorrow at 2 o'clock, additional numbers, and we'll have some other announcements for you that will hopefully be interesting. And thank you all very much. Have a good day. Thank you all.